It's the words no patient wants to hear from their doctor. It's terminal, followed by an estimated time left to live. What often happens next, if it hasn't already begun, is fear and panic setting in, as the medical condition robs and destroys any quality of life and enjoyment, all while leaving family and friends to watch helplessly as their loved one deteriorates in agony, oftentimes with pain before their very eyes. The question becomes, what can you do? For some, the decision is to end their life through a process called medical aid in dying, also known as MAiD, where a competent adult with a terminal illness is prescribed a self-administered lethal medication to end their life. It is a controversial option, legal in only 11 parts of the United States. Now, those fighting against MAiD claim it is nothing but assisted suicide by unethical physicians who are helping to kill vulnerable adults. My first guest, Meg, was once a successful bodybuilder, outdoor enthusiast, and known as a social butterfly. But Meg says that person is long gone. And all that's left is a shell of her former self that suffers every day from debilitating pain due to permanent spinal cord damage. Meg says she has made the decision to medically end her life. But since she doesn't have a terminal illness, she's forced to travel overseas to Switzerland, where she has been given the green light to schedule her own death.
I was an athlete, and I did some fitness competitions and some fitness modeling. I had a very big life. I was very happy, I was fun, and that's just not something that I'll ever have again. I don't feel the joy because it's muted over by the fact that no matter what, I'm going to have this pain that is so loud, I can't hear anything else. So now I have a permanent spinal cord injury called spinal cord myelopathy. I needed a posterior fusion, which was my last big surgery, where I have a 6-inch scar in the back of my neck and a spinal cord stimulator. It's just unbelievable how limited and small my life is. I can't sit in a chair or sit on a couch. Sitting here is very painful. Normally I stand. It makes me so uncomfortable just to sit in a car. I can't do showering. I have to not do things because it will put me in bed for 3 days. There's no way that I'm gonna live like this for the rest of my life. I feel like I'm trapped in a body. My mind is still that person. I just believe firmly in people's choice to end their life the way that they want to. There's nothing happy about this decision. I don't want my life to be over, but I felt like it was kind of over a long time ago. It took years for me to get comfortable with this decision. And when I realized how bad the pain was and that it wasn't getting better, it became easier to accept. I can't be fake anymore. You get to this point where you're just done. It brought me a lot of joy knowing that there was an option to turn my pain off. What I choose is quality of life over quantity of life.
Meg, I'm glad you're here, but I'm sorry for the circumstance.
Yeah, thanks for having me. I appreciate it.
It's difficult for you to sit for long periods of time, right?
Correct. So I'll squirm a lot, but
Yeah.
yeah.
If you need to stand up behind your chair or something,
I appreciate that.
do whatever you have to do to get through this.
Okay.
You say if your pain doesn't subside, you plan to medically end your life within the next 6 months, correct? What is your diagnosis and circumstance?
I have something called cervical spine myelopathy. It originally started out as a 2-level disc protrusion with facet joint arthropathy that caused nerve damage to my right arm. It initially started in 2015. They thought I had lateral epicondylitis in my elbow. They operated twice on my elbow. Didn't work either time. And the pain slowly went up. And finally, I went to a third hand and arm specialist, and he said, let's take a picture of your neck, because I was getting tightness. And instead of having a lordotic curve of my neck was kyphotic, so it was completely bent the other way. So within 2 weeks, I'd seen 2 neurosurgeons and orthopedic spine surgeons. 3 of them recommended fusion, and 1 disc replacements, which is what I wanted. because I was hell-bent on getting back to competing and continuing on with an active life. And I thought that that would give me the best ability to have the motion in my neck required to do so. So I went ahead with that surgery, and within a year of having that surgery, I didn't get better, I got worse. I kept telling my surgeons that my pain was getting worse, and they told me the scans looked like the bones were fused. I was sending them CAT scans, and they were telling me I was fused. And finally, when my feet went numb, they did further imaging and found out, in fact, that my neck was not fused, that the bones were moving in and out of basically where the cage was, and it was hitting my spinal cord. So then that caused the permanent spinal cord damage. So over a period of 2 years, as they told me nothing was wrong with me, no one was listening to me about my pain getting worse.
And they're telling you there's nothing they can do to repair that.
So I had the posterior fusion in last September, and they were very honest with me. They said, this is to progress further damage to your spinal cord. It won't necessarily fix the nerve pain. There's a chance that it could heal, maybe stop some of the nerve pain, but they were honest. Like, when someone has this injury, it's usually permanent. The cervical spine myelopathy, which was diagnosed from an EMG, there was a small percent that I might get better, so I was waiting for that. I was hopeful.
What's your pain average on 1 to 10?
Right now, like a 7, an 8, and like, it's, I'm used to this sort of pain, so people look at me all the time and say, but you look fine. You look like you work out. Well, when you live in this kind of pain every day, you learn to work around it. I mean, you'll see me squirming, and the pain in my arm is intense, but I can't seem to do anything to get it down. I've tried all these alternative therapies, and no, they're not recommending. I most recently got a spinal cord stimulator implanted about 5 weeks ago. It's a battery that goes in my glute and then up into my spine, and it's controlled via this phone, and it sends an impulse that's supposed to break the pain stimulus to the brain. But we haven't found a program yet that's helped with my pain, really. So I'm trying to stay a little bit hopeful with that, but it's mostly checking boxes at this point, but no further surgery is recommended.
So your pain right now, as you sit here, is what?
Right now, it's a 7. So, I mean, I medicate right when I wake up in the morning just to get out of bed. And then usually it's every 3 hours to get me through the day. If I didn't have those medications, I would not be able to work. There's absolutely no way. It's blinding pain.
So you're taking opioids or whatever
Opioid pain
to block it?
medications, and muscle relaxer.
So your options are either lay in bed and just take pain meds for the rest of your life, which you don't want to do, just be a zombie.
Right.
Or get up and try to live with it. Do you have any hope for any breakthroughs in the future?
Well, yes. I mean, if I knew, if you could tell me for certain that I had to wait 5 years and there was going to be a new something that they could rebuild the spinal cord, could I hold on? Yes. But my life right now is standing up. I have a standing desk. I work all day, and that's not going to continue for much longer. Like, I cannot keep pushing through the pain every single day. Before the feet went numb, I could maybe go out every once in a while and put on the smile and be with my family and be with my friends and tough it out through those couple hours and pay for it. The next day would be bad. It's not worth it for me to keep doing this to myself.
Despite some post-election optimism, Wall Street is already bracing for a rough rest of 2025. When Warren Buffett starts dumping blue chip stocks and stacking up cash, you've got to ask yourself, what does he see coming? I trust Preserve Gold to safeguard my accounts, and I urge you to do the same. They're the only precious metals company I recommend. When uncertainty is this high, smart people look for stability. That's why physical gold and silver might just be what your finances need. Text Dr. Phil to 50505 to get your free precious metals guide from Preserve Gold. With gold prices recently breaking records and analysts predicting this trend to continue through 2025, you cannot afford to wait. As a bonus, you can get up to $15,000 with a qualified purchase from Preserve Gold. So don't wait. Text Dr. Phil That's DRPHIL to 50505 today. Imagine living every day in horrific pain with nothing able to relieve it. A lot of people have had really difficult pain, some even chronic pain, but there's always that light at the end of the tunnel where, look, I can get through this, it'll get over. And it's very different when there's no light at the end of the tunnel, where that's just the way it's going to be every hour of every day for the rest of your life. Now, Meg says that her life, due to permanent spinal cord damage that has crippled her so much that she has chosen the option to medically end her life. With a timeline in place, Meg is now faced with how she will spend her last few months alive.
I'm now planning what my bucket list is, and it's becoming more and more obvious that sometimes that isn't even a possibility because you're in so much pain. My plan was to go to Hawaii and live out the rest of my days somewhere happy. As I get ready to go to Hawaii, I will start throwing things away. I'm not gonna need my dishes anymore. I wanna leave the money for any kind of funeral arrangements. And then my dog, she always just did really well around children. So I was looking for a family that had kids because I want her to be happy. I plan on sending my family some videos. I've actually already started making them. I have things that I want to address with them. I think it's easier for me to address it in a video since it's making them so uncomfortable to talk about it to me. Oh, I'm devastated. I get sad thinking about the fact that, like, I'll never fall in love again. I can picture myself in that bed at the clinic pressing the button, and I can do it without coming to tears. I imagine relief of pain.
Meg, you say when you think about that ultimate moment of pushing the button that will medically end your life, you fear when you get to that point whether you'll actually do it or not. Do you vacillate on that?
I did for a really long time, and now I don't for a really long time. And I even, the first step was looking into a place called The Final Exit, where they give you a handbook on how to do these things yourself, find the medications, the 5-drug cocktail. And the thought of hurting myself, like going to a hotel room or using a gun or some kind of rope or pills, that would bring me to tears because I deserve a peaceful death. I deserve to be surrounded by people that love me. And I want my family to have as least amount of trauma as I can give them by choosing to be surrounded by people I love and knowing that I'm going in peace. So for about a year, I would picture that moment, and I couldn't get past that moment without crying. But within the last couple months, with the escalation of pain and the fact that, the next step for me, they want to put a pain pump in me, like what cancer patients have, this big balloon in my stomach with it. I don't want the answer to be more and more meds. I bargain, can I just get 30 minutes of outside time 3 times a week? Can I go out to dinner once a month and actually enjoy myself? Like, I've bargained my way into this small existence to nothing. So no, it doesn't scare me anymore.
Because your life was very different before. You said you were a wild child, you were energetic, you were healthy and vibrant, and you live life to the fullest.
Yeah.
This is a real contrast to that. And your world getting very small is something you say you could deal with, but being very small with just blinding pain and suffering is different. You're looking at if this is my life, why do it? Is your point.
When I leave, let's say I work all day and then I go downstairs and I say hi to my roommate because I can no longer live by myself because I can't do things by myself. So it's taking away my autonomy. And, that's a thing. And then I go upstairs, and while they're downstairs watching TV, I'm on an ice pack or I'm pacing back and forth in my room. I have 3 heating pads set up. You know what I mean? That's how I'm spending every evening, just waiting for the second that I can fall asleep. And that isn't life to me. I don't want to live like that. So.
And most of your family is not supportive of this decision.
It's interesting. They won't talk about it. I have 5 older siblings, and they have been my lifeline. They moved me home, so I got to spend time with them, but they saw how I was living. So it became like they would get so angry when I would even bring it up, and now it's way more. They are watching me go through the list and try everything. I did not go down without a fight. You know what I mean? And we went to Northwestern, we went to Cornell, we went to Johns Hopkins, we went all over, and they were right next to me, you know, watching me suffer. And I don't even go to family parties anymore. So one of them is very angry, and I don't blame him. He can't accept it, and I can't force him to. But the rest of them, I think, even though they won't say it, they understand, and they're not going to be angry with me.
And do you feel like you have exhausted every alternative, seen every specialist, the best options that are possibly available? You feel like you've exhausted those?
I think the only thing that I really have not tried is stem cells. And, you know, it's not cheap. I mean, I've gone through pretty much I had a really good retirement. I have a good job. I'm very educated. You know, I had a great career. But I've spent all that money doing all of these alternative treatments. And the last one is stem cells. And I am willing to try it. But, you know, there's no research that shows that it helps with cervical spine myelopathy. I cannot find any paper. So if there's a doctor out there that knows of something, I'm open. I'm all ears. I want there to be an answer, but I'm also understanding that some people have bad things happen to them, and it happens to good people, and this is my bad thing. And I'm at the phase of grief where I'm accepting it.
So if you could even cut it in half, it would be something that would give you hope.
Yeah, I would take under a 5.
Let's discuss preparedness, because we know emergencies happen when we least expect them, but instead of just taking it, we can prepare. Let's discuss Jace Case, one of your most important preparation tools. With Jace Case, you'll have emergency prescription medications on hand right when you need them. Think about it. Ever been caught off guard? Whether it's a sudden illness or a travel hiccup, the right medications can make all the difference. Jace Case is designed to take that worry off your plate, so when a minor health issue pops up, it doesn't turn into a major problem. Don't let unforeseen circumstances derail your plans or your peace of mind. Live with confidence. Take charge with Jace today. Visit jace.com and use code PHIL for a discount on your order, and get emergency antibiotics on hand for the moment you need them. That's JASE.com, code PHIL, PHIL. When it comes to Meg's final moments before she self-administers a prescribed life-ending medication in a facility overseas, she won't be alone. And she won't be alone because her best friend, Kelly, just won't allow it.
Megan really cannot do much. She cannot work out. She cannot enjoy a dinner. She cannot have a dating life. Megan's pain is so severe that she doesn't drive. She can't clean a house. She can't wash dishes. She can't take her dog for a walk. She just physically can't. Her pain is going to exacerbate to levels that even I don't understand, and it's getting worse. Megan told me about the voluntary euthanasia 3 years ago, and I really, really was so against it, and I just fought her, and I'd cry. And once I saw that her quality of life really was diminishing, I started to think, I don't want her to do it, but I understand. When Megan was granted the green light, honestly, it was a sigh of relief. In her mind, she's thinking, okay, I can't control my pain, but I can control when I want to do it and how I want to do it. I do want to be present with her when she decides to do this. If I wasn't there, I would have so much harder of a time mentally. It's going to be so hard for me to get on a plane and know I'm going with my friend and coming back by myself. I will have to probably spend the rest of my life talking to somebody in therapy. I don't know how I'm going to live the rest of my life without her.
Well, Kelly, you say despite how traumatizing it may be, and I mean, clearly it will be, you refuse to let her die alone.
Mm-hmm.
You just feel like you have to be there.
I do. She has been there for me. I mean, we both are pain patients. She's been there for me during my cancer, during my spine surgeries. We talk every day, and I feel like I just have to be there. I have to. It will bring me peace of mind also.
Do either of y'all have any moral quandaries about this, whether you have the right to do this or not?
I mean, I think when a person is terminally ill or they cannot enjoy their life, then I think that it's okay. My mother suffered from ALS. She had the bulbar form. It was the most extreme form. She was dead in less than 2 years. She lost her ability to speak right off the bat. And I feel like after watching her and knowing what she went through, I think if she had the option, she possibly might have taken it. I'll never know because she couldn't speak, but the suffering that she did and the no quality of life, I think she might have made that decision.
Have you thought this through in your mind?
Yeah, I mean, how Kelly and I met, we went to all-girls Catholic high school. I was raised Catholic from an Irish Catholic family, so I was raised believing in hell and believing in purgatory, and I spent my adult years in my 20s searching for different forms of spirituality. I went to Thailand, meditated with monks, and kind of went through the gamut. I did think a lot about that, and I came to the conclusion that I don't believe that God is a punishing God, and I don't think that he makes mistakes. And if this is a decision that I make and follow through with, then it was always supposed to happen. That there is no mistakes. And I also, with the whole reincarnation thing, I thought to myself, you know, you're driving yourself crazy listening to all these spiritual leaders talk about being reincarnated. And I was like, hey, you know, you didn't know you were gone before you got here, and you're not gonna know you're back, and we were before, so stop worrying yourself sick about it. So that's kind of where I got to with that.
You know, coming home and slipping into my cozy earth pajamas and crawling into bed with their ridiculously soft sheets has transformed my nights into the most relaxing part of my day, all because of Cozy Earth. The Cozy Earth sheets are breathable, so I sleep cooler, and the fabrics are durable. If you haven't tried Cozy Earth yet, you're missing out on what feels like a 5-star hotel at home. With a 100-night sleep trial and a 10-year warranty, you've got absolutely nothing to lose. Luxury is in reach. Visit CozyEarth.com and use my code PHIL for up to 40% off sheets, towels, pajamas, and more. If you get a post-purchase survey, tell them you heard about Cozy Earth from the Dr. Phil podcast. Sanctuary awaits at Cozy Earth. How will you say goodbye?
I have to be there for her. I have to be strong. I mean, I'm not going to be able to be at peace. I'm going to say goodbye and know that when she's finally falling asleep, that she's no longer suffering anymore. And, you know, the thing I want to say about pain is people with pain, I'm sure there's people in the audience, we don't look like we're sick. And when we say, you tell somebody that they have cancer or you tell somebody they have ALS, people like, oh, you know, they sympathize. Oh, you know, we'll be there for you, we'll be there for you. But when it comes to pain, people look at us in a negative light. She has been there for me so much that I have to be there for her. And it will bring us both peace if I'm there. She will be at peace and I will be at peace.
We took a poll with the audience, which we'll talk about later, but we did a national poll also. We asked these questions. If an adult were to have a terminal medical condition, do you believe a doctor should be allowed to prescribe a medication to end his or her life? And this was the response. 72% said yes, 28% said no. And then we asked, if a person were to have a non-terminal medical condition but suffered from a debilitating mental illness, should a doctor be allowed to prescribe a medication to end his or her life? So not a terminal medical condition, but a debilitating mental illness. And that was about 50-50. And in question 3, we said if a person had an incurable but non-terminal debilitating physical medical condition, do you believe a doctor should be able to prescribe a medication to end his or her life? And the results were 56% yes and 44% no. So their thinking was if it's a terminal disease, they felt pretty strongly about it. If it wasn't a terminal disease, they were more divided about it, and certainly if it was a mental disorder, because I think they feel like if it's not terminal, then maybe there's hope of finding something somewhere. And you feel like you've turned over pretty much every rock there is to turn over.
I do. I don't think that I would put a dog through what I'm going through.
Yeah.
In fact, I know I wouldn't. I watched my mom die of cancer and my best friend of brain cancer, and we did things to hasten death towards the end. I think that we didn't do it soon enough. I don't believe that people have to suffer. I think it is their choice. I think that what's happening in Canada is happening really fast with the medically assisted aid in dying laws being changed for the mentally ill. I'm not a psychiatrist. I don't know how I feel about that. I just know what's right for me. I do believe it's moving very quickly there. It's a slippery slope, and they may hurt the rest of the world by moving too fast. Not having strict guidelines to assess these people. Have they tried every single thing? And I don't know the answers to that. I'm not here advocating to change the laws. I just know that I can't keep living year after year waiting for a magical cure to appear when there hasn't been since 2015 when this all started.